A very good day to everyone. It's a pleasure from the Western Pacific region for me to present on diabetes and health-related quality of life. Now, if you know, basically, this is a great celebration looking at the World Diabetes Day. And this year, World Diabetes Day basically looks at diabetes and well-being, basically. This is the hospital I'm from, Kuala Lumpur Hospital, which is the largest hospital in Malaysia. We have about 2,400 over beds and about close to 12,000 staff. Now, World Diabetes Day basically was celebrated on the 14th of November 2025. We decided basically that, this is a flagship program of DFO International and it has to be done every year. So this year, on the 16th of November, we have 7 regions basically celebrating World Diabetes Day continuously the whole day from 8 CET until the evening in Central European time. Now, as I mentioned earlier, World Diabetes Day 2025 talks about diabetes and well-being, and DFO International, being the implementation arm of the International Working Group for Diabetic Food, is very involved in the World Diabetes Day and is our flagship program. Healthy steps for diabetic food in diabetic food awareness 2025. That is what DFood is actually preaching, and this is our diabetic food awareness week. Basically, many countries are actually celebrating it as a global act against amputation. Now, what the main mission of DFO International is to actually prevent avoidable amputations. That is very, very important. So how many of you have got these kind of legs? Clear, beautiful, moist, basically. And in the patients who have diabetes, basically, with diabetic peripheral neuropathy, with autonomic neuropathy, they don't actually have much hair, it's dry, basically, and then there's fissures, and then in diabetic sensory neuropathy, you find these insensate feet, and then with motor neuropathy, there are also deformities and all that. Now, diabetes is a global emergency. The World Bank divides the whole region of Earth basically to 7 regions, and we are in the Western Pacific region. And one of the things that we find basically is 5% of all diabetic patients have history of food ulceration, and more than 25% have a cumulative incidence of this food ulceration along their lifetime. If you look at the global achievement in terms of target for HbA1c, we find even in Malaysia, basically, only 22% actually conform to it, who actually get HbA1c below 6.5. Other countries, the same concept also. So when you talk about the concept of well-being, you talk about healthy steps, you also need to get targeted glycemic control. If not, basically, the complications will be astounding. In 1998, David Armstrong mentioned that basically diabetic foot complications can be prevented by up to 85%. Yes. And this is by basically proper assessment and also looking at your proper glycemic control and all that. So therefore, we need to control all this, examine your feet, make sure what you call this, the footwear is very important. With that, basically, for the Western Pacific region, we came out with the diabetic foot ulcer care in the Asia Pacific region. And this was actually a consensus document under WUNS National, and we actually published it at that time. And there were many consultants and specialists here, including what they call this 2 presidents from DFO International and also from the different countries, basically Singapore, Taiwan, Vietnam, Thailand, India, Sri Lanka, and so on and so forth. The International Wound Infection Institute also came out with a document this year on therapeutic wound and skin cleansing. That means when you look at diabetic foot, we're always thinking about the aspect of management. That means cleansing, debridement, refashioning the edge, and also dressing with, let's say, biofilm-based wound care. We call it as wound hygiene now. But in therapeutic wound and skin cleansing, we go into cleansing itself, what needs to be done. And then we have got the IWI wound infection continuum, where they actually look at contamination, colonization, local infection, spreading infection, and systemic infection. So these are the covert and overt signs of local infection. And you can see basically, we're all looking at the management and treatment. But one of the most important aspect here is the prevention and later on the follow-up. So the use of antiseptics in practice was also what they call this another consensus document, all right, basically as more of case studies and research was done. So the burden of non-healing DFUs affects millions globally. The pressure on healthcare systems due to high costs, projected rise due to aging population and comorbid conditions, especially now with geriatric population, there's a huge increase, and also reduces the quality of life significantly. Now, that is what basically I would look at, because when the quality of life comes down and you live longer, is it actually worth it in that sense? Because a lot of them basically physically also have problems, mentally also has problems, and the budgets of the country are insufficient to actually manage them. So we look at the impact of quality of life. Non-healing wounds drastically reduce patients' quality of life by limiting ability to perform activities, causing discomfort, social isolation, all that. So they get depressed. Impact on age. There is complex non-healing wounds may affect both young and older people, often linked to diabetes and all that. In this case, we're going to talk about diabetes and diabetic foot ulcers. The economic and daily practice impact is another aspect where you need significant resources translated into high healthcare costs and dedicated time for care. This is Maldives, basically. Nice, beautiful, all that. But you need to go when you're actually healthy. So one of the things about diabetes basically is in well-being, you also need to make sure you look after yourself well, and you should be able to relax and go to places like Maldives, which look so beautiful. And our fourth D4 International Conference will be held in Maldives next year. Now, if you look at the pillars of well-being, since you're talking about well-being, looks at physical, family, looking at environmental, financial, mental, and also looking at the career. So they should be able to perform, they should be able to fit into all these pillars. If you look at the health-related quality of life, it is actually a multi-dimensional assessment of a person's health, encompassing the impact of physical, psychological, and social well-being on their ability to live a fulfilling life. It is a patient-centric measure. So we talk about patient-centric care, we talk about looking at the whole patient and not the hole in the patient. All this is important. And this reflects how health affects the individual's functioning, feelings, and overall perception of life, and is distinct from general quality of life by focusing only on health-related factors. So we need to look at that. And health-related quality of life is something that we looked at basically even in the UK about in 2010, basically, lots of studies on it, all that. And so now we have come back for diabetes and well-being. And the key aspects of health quality of life: physical health, number one. This includes patients' energy levels, pain or discomfort, and also the ability to perform daily activities like mobility and self-care. This is very important. Everyone wants to stay young, wants to be able to do things by themselves. Psychosocial health covers the emotional well-being, mental state, the absence of conditions like anxiety or depression. Patients who have diabetes are actually quite depressed. They have to take medication continuously. Those who are taking insulin, basically basal bolus regime 4 times a day and all that, are quite depressed with their condition. And then a lot of food that they can't eat, and they have to control their food. They have to exercise. They have to do a lot of things to control their glycemic levels. So this has a profound effect on the mental state and the biological effects and all that. And that's not counting also all the complications and side effects. Social functioning this actually affects their social relationships and interactions with others. That means how you interact with others, how you feel about yourself, and you're able to actually interact with these people. So this patient-centric perspective, where health-related quality of life measures health outcomes from the patient's point of view, not just from clinical or professional standpoint, because the patient is your client and he's the center of your system. Now, if you look tools like the HRQoL 5 dimensions, where they look at questionnaires of, EQ5D measures quality of life across 5 dimensions: mobility, self-care, usual activities, pain, discomfort, and anxiety and depression. So you have dimensions of well-being. People look at intellectual, physical, social, spiritual is another aspect, vocational, emotional, and environmental factors. And then you got quality of life in other sense, where it looks at a lot of health related quality of life, material aspects, quality of spiritual, psychological effects, quality of working life, quality of life in the family. Now, why working life? Basically, because nowadays they are extending the time for retirement. And diabetes is also affecting the patients much, much earlier. So in a quality of life survey, which was actually designed in the NHS UK, they looked at mobility. Are they able to walk, jog, exercise, friends and relationships, And how's the overall health? And what are the symptoms that they're having now? In the same time, basically looking at everyday tasks and all that, are they able to perform basically all these tasks at home? And the anxiety and stress levels. Now, these affect patients. And patients with diabetes have a lot of stress involved because with medications, with control, and a lot of things that they can't do normally. That means you talk about foot care, footwear, and all these things. So they can end up basically with depression, anxiety, and all that. So we have to be quite happy and quite careful with them. So it's important to actually look after them well. Now, the World Union of Wounding Societies, where DFO International is also a supporting society, has also come out with consensus documents and all that, looking at different types of aspects. And one of it is wound balance. Now, in wound balance, they actually looked at the implementation of this wound balance, where integrating all these clinical factors, biomarkers, wound assessment, all that, into the patient needs and effective communication, and to support a more comprehensive patient-centric care. So if you look at this, it's a proactive care concept with a holistic patient-centric approach, balances clinical care, wound care, and patient care dimensions, and the focus shift from wound management to wound healing, and supported by the global wound care experts applicable across various clinical settings and wound types. Now, if you look at wound care, we look at like basically biomarkers, oxygenation, trauma, comorbidities, critical for wound assessment. That's when we look at diabetic foot ulcers, we look at all these things. Now, we move a bit further when we look at this year's aspect, where we're looking at patient-centric care, focuses on the quality of life, effective communication, personalized treatment goals for patients. And you need to balance this in clinical care, where balancing clinical practice involves continuity of care, realistic time management, and early intervention strategies. So, why is this essential? Address the molecular systemic factors, support early intervention, provides structured decision-making support for clinicians at any level. So when you look at biomarkers, MMPs, macrophages, the receptors 1 and 2, elastase, calprotectin, growth factors, a lot of things. And you look at these impacts. So this is basically where you're looking at the patient, all right, at the wound itself, the diabetic foot ulcer. And then you move basically to provide early intervention. And this is where you prevent wound-related complications, you align therapeutic intervention, and support the shift to normal wound healing progress and optimal recovery. So always ask the patients about their health-related quality of life. What do they want to achieve? What do they want to do? What is their aim in life at that stage of life? And many people use timers, biomes, times, triangular wound assessment. People use triple dressings, super absorbent dressings. But here I would like to stress on patient education and individualized care. So you should educate the patients in what their needs are. Because many years ago, we did a study and we found that unmet needs is another problem that patients actually have, where they come in to ask questions, this and that, and then, find that we are so busy basically managing the patient's wounds or diabetic foot ulcers that we don't actually look at the patient holistically. And so we need to create personalized care plans to enhance healing and patient engagement. A clinical integration of wound balance is very important into all our clinical workflows. So the key benefits are basically what you call is you can actually manage them well, wide applicability, and look at the implementation strategies and continuous improvement before we can actually go to places like this. So there's a lot of things they can do as near normal as possible. So we shouldn't basically limit patients with diabetes. And that's why this year, diabetes and well-being, we're trying to look at the health-related quality of life, trying to look at the patient as a human being and able to perform most of these things. So the 12 key steps to diabetic foot health, you're talking about basically looking at the foot. So basically, with proper stockings, comfortable stockings, so that the do's and don'ts are very important. And then we have got the foot care guide, how to look after your feet. People talk about washing the feet. People look about moisturizing the feet and also cleansing the feet, drying the feet. All this is important. And healthy feet, happy life. That's important. So inspect your feet, wash and dry your feet, and moisturize the feet. So this is the fourth conference which will be held in Maldives. The first was in Malaysia, second in Mumbai, India, third back in Borneo, and fourth will be from the 1st to 2nd of May 2026 in Maldives. Similarly, basically, we are having the World Union meeting in 2026 with the theme of Global Paradigm Shift, Wound Management Specialty Recognition, from the 23rd to 27th of September 2026 in Kuala Lumpur Convention Center in Malaysia. I would like to invite all of you all to actually attend this particular conference. And DFood International has got basically a very good symposium and sessions even in this. And the whole board will be there. So it's a pleasure to actually have all of you over. And with that, let's take care of our patients well, holistically and comprehensively. And with that, I'm signing out from DFood International. Thank you very much.